Okay, I guess we are ready here. I want to welcome everyone to the Eastman Cares COVID-19 seminar series. This is our fifth one. It's done by the Eastman Cares Education Committee, which is Ken Dolkart and Sally Wood and Elise Kendall. So I thank them for their assistance. A couple things before we start. I want to remind people, as I always do, of the Eastman Cares Community Resource Guide, which was updated this fall, which is available at South Covent online. So please feel free to use that. I think it's a really good resource guide, and it's updated periodically to be sure our information is accurate. Secondly, I want to remind people of something that's relatively new, the Ecares Connection. And that basically is a resource that is available to anyone who would like someone to call and check in or just have a conversation. We could call daily, weekly, monthly, whatever the need is. And that can be arranged. We have volunteers who are willing to help with that. That can be arranged by emailing eastmancares@eastmannh.org, and I will be referring to that again at the end of this. I want also to talk a little bit about the next presentation. The next presentation is January 22nd. It will be COVID-19 versus flu. How can we tell? It will be done by Dr. DeMaria. Dr. DeMaria, who both Paul and I have worked for actually, was a medical director for the Bureau of Infectious Diseases and the state epidemiologist for Massachusetts, and he's a wonderful speaker. And I think there's some interesting questions here about where is flu, and do we have to worry about it, and what are we looking at in terms of next year, et cetera, et cetera. So we're looking forward to that. That's January 22nd, same time, of course. And finally, to introduce our wonderful team here, but I'm going to actually be the one introducing just Bill, and then Bill is going to take over. Bill and his wife Donna first came to Eastman about 10 years ago, and it was recommended by friends, and they came and they enjoyed it so much that they purchased their North Cove house in 2013. And like all of us, the more time you spend in this community, the more enamored you become of what a wonderful place this is to live. So they did decide to make Grantham their primary residence, and they have, as everyone knows, been very involved in really all aspects of Eastman life. Bill has a degree in industrial and labor relations from Cornell, and then he joined IBM straight out of college, where he spent a number of years working in human resources, traveling, spending some time in Japan, etc. He retired after 10 years with Boston's Analog Devices, where he was on the senior executive team, responsible for human resources for 10,000 employees. I think, as everyone knows, he has now served on the Eastman Board of Directors for 5 years. Thank you, Bill, for your wonderful service, and as president of the association since 2017. And a note of thanks again to all of the people that you will hear from today. From all of us in the community, our thanks, and I'll turn it over to Bill.
Thanks, Sue, and thanks to Eastman Cares for this forum. The faces you see on your screen are actually people that get together every Tuesday morning at 8 o'clock to talk about Eastman's approach to COVID-19. And what we thought we would do today is try and give you a sense of some of the things that we've done to prevent the spread of the virus here in our community, and also to, at the same time, maintain the amenities and the things that make this such a great place to live. This timeline slide that you see talks about where we've been, and gosh, it's just amazing to think what's happened over a little less than a year. Back in March of 2020, in the early days of the pandemic, very quickly we realized that we had some big problems as a nation and as a state, and actions were taken in accordance with that to shut everything down to stop the spread of the virus. You might remember Governor Sununu's safer at home order, and around that same time everyone was advised that we should just shut down, and that's what Eastman did as well, shutting down all of our amenities so that we could stop the spread of the virus. You know, shutting things down is actually the easy response to things that we have seen. The much more difficult task is trying to figure out how do you begin to reopen and do so safely, and do so in an environment where there are natural concerns about people's health and welfare. We knew early on that from a board standpoint, we didn't have the expertise, and Ken Ryder, who at that point in time was still the general manager, understood that we as a community could really benefit from some help and from some smart people who understood the science and could guide us in the ways of safely reopening our community. And that was the genesis in April of last year of the health advisory panel that you will hear from and get to know a little bit better today. They, as guidance was offered from New Hampshire on some of the things that could start to reopen, would think about that in the context of our own local environment, our own local infection rates, and then begin the process of thinking about how we safely reopen Eastman. So what I'd like to do is to give the panel themselves an opportunity to introduce each other, and I thought I would start with Nancy Gagliano, who will take over to introduce Ken.
Hello, everybody. Thank you for spending a little time with us this afternoon. I'm delighted to introduce my dear friend, Ken Dolkart, who I have never met in person. One of these days, I will find out if he's bigger than this. As most of you know, Dr. Ken is a primary care provider. He's also a geriatrician. He retired in 2016, and like many Eastmanites, retirement does not mean sitting around fishing, whether it's ice fishing or regular fishing. It means just moving on to other jobs and other roles. He continues to teach at Dartmouth at the Geisel Medical School, as well as he does continue to see patients. It probably just means he's not being paid as much as he used to be paid for all the hard work he does. Ken has been here at Eastman since 2007, and he and his wife Vivian are active participants in the Eastman life. Spend a lot of time with their family. He likes outdoor activities, and I understand he plays the guitar, but he has not yet serenaded us, and I think we're going to have to add that to one of our morning meetings. Thank you, Ken, for your friendship, for your honest dialogue. We've had some great spirited conversations, and I can't wait to see you in public without a mask.
Thanks, Nancy. That was terrific. Yeah, we'll meet one of these days on the golf course, maybe on skis, maybe not. We'll see. So, and it's been really a pleasure getting together every week with this team. There's a lot of good give and take, and it's been just a genuine pleasure. I'm going to introduce, with pleasure, Paul Etkind. And many of you know Paul. Paul is a retired public health epidemiologist who, prior to retirement, concentrated primarily on infectious disease. He worked at local, state, and national levels and remains active in numerous professional organizations. He's worked with the Massachusetts Department of Public Health and Nashua Department of Public Health and Community Services, Association of Schools and Programs in Public Health, and a National Association of County and City Health Officials. Like as Nancy was mentioning, many of us stay busy. I don't know what retirement really means, but he's lectured locally with OSHR and other local resources for the public regarding public health issues. You'll often read his letters in the Valley News or elsewhere when you're not reading his letters to our officials about our public health matters. So with that, I'll introduce Paul.
Thank you, Ken. Thank you, everybody, for being on this webinar, and also I want to add, this has been just maybe it's a perverse way, but it's been a lot of fun being on this committee. The discussions are invigorating and take me, and I think us, to places that we generally or maybe not have been before. So I want to introduce Dr. Nancy Gagliano. On the personal side, she and her husband Tony have been first part-time and now full-time residents here at Eastman for 20 years. Nancy has taken up golf and bridge here at Eastman since COVID. Two taxing activities, that's for sure. They have 2 adult children, neither of whom needed to come home for COVID. That's an accomplishment as well. Nancy's a primary care physician and spent 21 years at Mass General Hospital, and part of that was as a senior vice president at the hospital. She then moved on to CVS Health and was a senior vice president in overseeing their Minute Clinic programs. She's now working for the National Institutes for Health and helping to increase COVID testing.
So thanks to the doctors for those introductions. The best part of this panel, you can see an enormous set of qualifications for 2 baskets of tea, a couple of cups, and a bag that Leslie dropped off. We're good to go for probably another 6 months here. So we are very fortunate, because if you try to buy this kind of expertise on the marketplace from a consulting standpoint, I don't think we could ever afford it. What I'd like to do is go back to the presentation here, and if I can figure out how to do that, there we go. In the process of doing that, talk about the timeline and the fact that, you know, in the midst of all of this fun that we have as a pandemic, we decided that, gee, it'd kind of be nice to have a general manager since Ken was retiring. And right in the middle of everything, Steve Schneider joined Eastman. In fact, we actually closed the negotiations, and he accepted our offer the day everything shut down. And Steve likes to point out that we've never had the handshake which formally consummates this kind of a deal. So I'm hoping that he sticks with us even after we get to have normal meetings. But we have been enormously fortunate to have his help, having come from the Upper Valley Lake Sunapee Regional Planning Commission as executive director there, and before that 11 years as the town manager in Enfield. As Steve and Leslie have been working here in Eastman, one of the questions they've had is, you know, how do you safely reopen the place? And our strategy around reopening Eastman has been what I would describe as a belt and suspenders approach to safety. You know, this overall philosophy is around being able to avoid situations where those with COVID are using our amenities, and at the same time managing the amenities in such a way that if someone unknowingly comes and is asymptomatic and might be contagious, that we have managed the setting in such a way that we are not likely to spread the virus. So with that as a discussion about the overall philosophy, I'll turn the mic over to Steve. And I would mention, by the way, there will be 2 opportunities to ask questions. One, as we finish the slide on the philosophy, and then a second, as we finish the slide that talks about how we thought through specific situations. This is a great opportunity for you to take advantage of the panel, which, as I mentioned, just received that lavish compensation. You can send in your questions by either typing them in the Q&A part that you see either at the bottom or top of your screen. And you also have the opportunity to raise your hand if you are an attendee. If you raise your hand, I will see that and I will acknowledge you, and then you turn on your mic so you can ask the question live. But we'll let Steve and then ultimately Leslie talk through this particular slide, and then we'll take a break for questions here, and then again at the end of the presentation. So Steve, the floor is yours.
Okay, good. Thank you. Well, good afternoon, everyone, and thank you for showing up and participating here today. As Bill said, our philosophy is belts and suspenders, and so what I'm going to describe here is how I'm dividing those into action here. So for me, the belts are communications and the suspenders are our actions. And so ultimately, you know, our goal is how can we safely open our amenities for both the community and the staff members. And so what steps have we taken to avoid those situations where those with COVID are using our amenities? So from a belts perspective, again, that's communication. You know, we're implementing clear communication to our community. We've had a series of what to expect when you come to one of our amenities in the spring. Of course, we had the golf course and the beaches, and at South Cove Fitness Center, and in the pool. So those documents really outlined kind of what you needed to do to prepare yourself to come to the amenity, but also you know, how the amenity may be a little different. So you know, for golf, early on there was a series of questions that screening questions that folks were asked. There were a lot of touch points that we eliminated early on, and so that was part of the what to expect. You know, and we've continued that into our winter season. So we've developed a bunch of what to expect for skating and skiing and sledding, and I would say that we've edited those and modified those as we've become more knowledgeable about how COVID is spread and impacts our community. So another belt, if you will, is that we've been installing, you know, signs throughout the community. I think we've purchased probably another half dozen or so of those signs. So they're out and about, and when you approach one of our amenities, I guarantee you there's a sign that says, here's kind of the rules and guidelines for being there. Another belt is that we reinforce these messages regularly through community forums. So whether it's messaging from Bill or in our highlights, certainly at board meetings and council meetings, we discuss COVID and our approach to that regularly. From the suspender side, again, this is an action. We've worked with staff to ensure that our working conditions are safe. You know, that's essential. So, you know, we're masking, we're doing temp checks, we're making sure that we're socially distanced while we're working. There's plexiglass between workstations in public areas. You know, without the staff, the amenities could be there, but they would really kind of be not usable. So it's essential that we make sure that the working environment for our staff is good as well. Another suspender is that we're limiting congregation points. So while we're at the center in South Cove, you know, we're trying to manage places where people can congregate. So in the golf season, you know, you had to be in your car up until about 10 minutes before tee time. At South Cove, reservations are still required to use the fitness center and the pool. We also limit the number of participants within those amenities. And in fact, this week, I arrived early for a workout and was told I needed to wait because the fitness center was full and the next group coming in was also a full load, if you will. And so that suspender, you know, is again limiting kind of the opportunity for people to kind of congregate. Another suspender is masks, and so we're requiring that masks are used throughout, inside our structures. So in South Cove and in the center, and again, while you're within kind of the general area of those buildings as well, where we might expect people to kind of be. And so, as Bill likes to say, these are belts and suspenders, and through communication and the actions that I think we've implemented to date, we've done a real good job of making our amenities safe for the community and also our workers. And so, Bill, I guess I'm going to introduce Leslie. Does that sound right? Okay. I've had the pleasure of working with Leslie for, 9 months? And she is the director of fun and is in charge of all the activities and the amenities that we have here at Eastman. She's been here. She's one of our short timers. She's only been here probably 20 years and remembers all of the old things that Eastman used to do. So she can tell stories about, when Snow Hill was still active, and the hot chocolate stories that she would have. One of my neighbors, John Markowitz, was a former Eastman director of fun, and he's got some good stories to share about Leslie as well. So I'm excited to be able to continue to work with Leslie, and she's done a fantastic job for us so far. So Leslie.
All right, so Happy New Year, everyone. And want to say thank you and how much I've enjoyed, as much as you can enjoy, talking a lot about COVID every Tuesday morning and the help that I've gotten from this panel. Steve covered a lot of the things that we've done to keep our amenities safe, but it all really starts with a draft guideline that we put together, and we look at CDC guidelines, we look at what the state is recommending, and then I bring it to a morning meeting on Tuesdays to what I call the review team. And they go, yeah, that makes a lot of sense. Well, no, that doesn't make sense. And then there's usually some discussion one way or the other, and we come up with what we think the safest way to open our amenity or to run an event is. So that's included, some of the things that Steve talked about: wearing your mask, social distancing, limiting the number of people that can come into the facility at a time, certainly the screening questions that we ask people when they use the amenities. And those have changed over time based on what we've learned, or for instance, they just changed recently because we saw the holiday season coming up. The other thing that we're doing, and when people come to the fitness center and the pool, and when they were golfing, is also to collect names, and at the restaurant as well, is to collect names. So in the case that we did have an outbreak that was related to, or an outbreak in the fitness center or say the pool, we have contact tracing. So that was something important that we've been doing too, to keep our amenities safe. Trying to think of other things, but I think Steve covered most of them when he spoke about the suspenders approach that we have.
So thanks for that, Leslie. What I'd like to do is kind of frame out the rest of the timeline, and then we'll kind of move into a typical day in the life of the health panel. The panel has been meeting weekly since June, actually probably even since May. Every Tuesday morning, 8 o'clock, before our days officially begin, we spend some time talking about what issues face the community and how to approach them. The meetings are run by Leslie, our director of fun, and I would just say, with respect to Leslie and Steve, whatever amount of stress and work you think is involved in managing through a pandemic, double it and you start to come close to what the two of these folks have dealt with over the last year. It's amazing to watch. Leslie is one of the most positive, upbeat people I can ever have met. A couple of times she said, when I asked her how things were going, okay, and that's when you know it's really stressful, but she always has a smile on her face, and she's done a great job of trying to tee up the issues for these weekly meetings that she seeks advice and counsel from the health panel on, that helps us to ultimately make good decisions. Believe it or not, in August, when I was still clutching on to the idea that maybe we wouldn't have snow this winter and would be able to play golf all year, the attention turned to the winter amenities and things we can do. I would also point out, in terms of mitigation actions that have been taken, UV lighting that was put into South Cove to help with the fitness center and the pool, more insight into airflow than I ever thought I would want to know, including modeling that comes compliments of MIT that helped us to understand what could be done to create a safer environment in the Draper room to allow us to have the restaurant running. And most recently, if you haven't been to the deck, fire pits and heat lamps that can be used for folks who want to enjoy time after skiing or just a happy hour outdoors where the wind blows, and if you can keep it warm enough, you've created the same safe kind of environment that we were all clinging on to this summer. So these ongoing meetings have been happening for quite some time now, and the basic objective of them is to support the general manager and staff as they make decisions on how to safely operate the amenities. So what I thought might be helpful is for Leslie just to talk a little bit about how we work down through these criteria, how the health panel helps with that, and for you to see some of the interaction that happens. I can tell you that the doctors approach this in much the same way they would if they were trying to advise their own families on how to safely navigate through these difficult times. So hopefully you'll get a picture of that in the time we have here, and we'll be sure to leave you ample time to ask the panel questions that you might have on specific things or just some of the health challenges we all face directly in this pandemic era. So Leslie, back to you.
Yes, so I wanted to start with talking about the first amenity that we opened or reopened, which was golf. And that again started with, a draft guideline of what we thought was appropriate based on CDC and state guidelines. And then I brought that to the review team and said, does this make sense? Should we put rakes out in bunkers? How should people be in their cars before they, go to the first tee to get started and things like that. So I was hoping that I could get Paul, Ken, and Nancy to kind of talk about some of the issues that we had as we were opening the golf course. When to open? Do we open to everybody at the same time? Do we open to out of state players? Do we open to public players? So these were, I kind of come to the meeting and just ask a bunch of questions and then we talk. So I don't know if Paul, Ken, or Nancy kind of want to jump in and talk about the process for opening the golf course and our thinking there.
I guess I could start. I think we talked about just the process, almost like a desk audit. When does a person come in? What do they do? And that's where you stay in your car until it's 10 minutes before you're ready to begin your round. We looked at what sorts of questions for an assessment of the person's health and well-being, and a little bit about their history. Where have they been in the past 2 weeks? Where are they coming from? See, are they coming from a higher risk area? Are they coming from within Eastman? And then once they got on the course, my goodness, touch points. Leslie talked about the rakes and the bunkers. To be honest, I had to learn a bit about golf because I've never played it, although I've only played it once, and that doesn't really count for experience. And so some of the golfing terms was a little bit of a mystery to me. And God bless Ken for his looking at the details. What kinds of airflow do we have through porta potties? Do we put porta potties out on the course? If so, where? you know,
We
and
spent more time talking about bathrooms on the golf course than you would ever imagine.
and this is one of the things I alluded to earlier when I said we've talked about things that frankly was quite the learning experience for me. But I mean, we can get around about that, but at the time, those were serious questions and valid questions. So why don't I, Ken or Nancy?
No, I think you summed it up well. It as some of us have commented, it's sort of like flying a B-57 while you're still building it. This was new to everyone in this society. It was a learning process. We had a shutdown because it was our first experience with the pandemic. The science has trickled in on a month-by-month basis. Initially with the golf course, there wasn't, you know, everyone was studying, oh, they have these lab studies about how long the virus lives on plastic versus metal versus cardboard. People were, you know, wondering, should I spray my mail as I pick it up? You know, these things were uncertain. And I think, you know, there's a lot of attention that Steve and Leslie really made to thinking about every aspect of the amenities and how we should address them. Bill was instrumental in this as well, you know, spraying the carts, putting out stuff for the golfers and making sure people were not congregating. It was a learning process. And for those of us who don't play golf every day, we tried to learn about it as much as we could. I've caddied, but I haven't played since I was 18. But so no, I think that was our real first experience. Do we open up Memorial Day? I mean, there were these issues at the time. Italy was going through all this craziness as we're going through now. So I think it's been an ongoing process. Basically, we had conversations, as Paul, you mentioned, do we allow players to come up for the day? We felt that was unsafe if we didn't, you know, they're not quarantining. We have no idea about what the transmission rate is in a particular community. We had screening at the entrance to the center. Folks who really had thought about this at a time when the Hanover golf course closed, other golf courses stayed open with different levels of security around these matters. So we were flying by the seat of our pants at times, no question. But I think there was some science we could base the decisions on. So,
Yeah, I think as Ken and Paul are alluding to, our job, I think it was easy when there was good science or very, very clear restrictions or recommendations. But there were so many pieces that there wasn't the science, clear science, or clear recommendations. And we were often, and that's where I think we worked really well together. We were trying to figure out the risk and the reward. And it's as Bill alluded to, so much easier just to close everything down because you know you're really reducing your risk, but we wanted to open things up. But, you know, the reward of opening up the amenity to absolutely everybody felt really risky in the beginning, and bringing in folks from different communities that had a higher rate, and we chose to be a little bit more risk adverse and walk before we ran, and slowly learned, and as the science evolved, changed. I remember having conversations about touching tennis balls, right? Oh my God, people could touch tennis balls and they weren't in the same family, and we couldn't let people touch tennis balls, so maybe they could pass the tennis ball by their feet and use their tennis racket to pick it up, or they should start with new tennis balls. So the balancing of risky behavior, what was risky behavior, how much risk should we take so that people could indeed enjoy the activity. I think after Bill almost fainted one weekend from dehydration, we talked about we should probably let water, we should probably let people sit on benches. It was definitely an evolving process over the entire course, and it still is an evolving process.
If I may, I mean, the importance of knowing, or at least having some basis in the science, as much as the science existed at each point, was very powerful for whatever we were suggesting. Because let's face it, golf is a major part of our financial picture here at Eastman, and golfers are, to be polite, are extremely avid about their sport, and they really wanted to play, and so there were those sorts of considerations that had to be part of the picture. But as long as the science was sound, I will say that most, if not all, really fell into line. And maybe that's the wrong phrase, but folks understood where the rules were coming from, and things opened up fairly well and smoothly. But that's the importance of having as good science as we can possibly find.
Yeah. So opening of the golf course, in comparison to some of the other amenities, I would say was easier. There was staff on site. Tea times were there to make sure people, came at a certain time and there weren't large gatherings. One of the harder amenities, at least in my mind, to open were the beaches. We started with the idea that every family would have, or individual would have, a 10 by 10 space on the beach, and this would be the capacity of the beach, and here's a sign that tells you everything about that, and a little demo square of where you should be on the beach. That did not work. So we spent a whole meeting discussing how to, maybe more than one meeting actually, about how do we allow people to use the beaches and the lake in the safest way possible. So maybe the docs can talk a little bit about how we came up with our beach host program and discovered what a COVID bubble was.
So I have to tell you, the beach issue was the most sad time that I experienced throughout all of this, because we had been working together as a group and had really been trying to open amenities as best as we could. And I remember the afternoon, I was out kayaking, turned the corner and saw North Cove Beach, and there must have been 30 to 50 people on North Cove. And if you've ever been to North Cove Beach, it's a small beach. I think we believe the capacity of North Cove to be about 16. And I was devastated. And I think about that time we had realized, the science had come through, that surfaces really weren't the issue. We knew that outside was dramatically safer than inside. But we also knew by this point that the virus did spread within 6 feet. And I saw a whole bunch of people very close together. And the other thing that I saw was that the entrance where people would walk through, there was a whole bunch of people congregated right by the entrance. So if you wanted to use the beach safely and go to a quiet corner, you had to pass by a whole bunch of people. So we learned very, very quickly that unfortunately, whether it was signage or knowledge or, as we said, large bubbles, we needed to do something pretty significant pretty quickly to be able to allow people to enjoy the beach safely. So the meeting after we opened up the beach, as you said, was a pretty intense meeting of very much focused on how in the world could we solve this? Because a solution was close the beach, but we didn't want to close the beach. We wanted to solve it. So I will pass on the baton.
I would just say quickly and then give it back to Ken that though at that same exact time, if you watch the evening news shows, many municipalities just closed down the beach. So you'd see empty beaches and lots of kids and families that were disappointed by that. So this panel worked very hard to come up with some different ideas on how you could maintain safety while allowing people to not taking the easy way out, which would be to have put up barbed wire and razor wire and keep it closed. So Ken.
No, exactly. You know, I think the interplay between natural human behavior and science is an interesting interface. And all of us who live at Eastman love the beaches. I think we all perceive it as a priority. It's a major part of living at Eastman, whether you're paddling on the water or you're at the beach itself. So some of us are close enough to the beaches to see how people were using them. We recognize that if we even tried to close the beaches, it wouldn't be successful. People wanted to be out on them in the middle of the summer. This is New Hampshire, and this is what we need to do. So we had to weigh that priority of maintaining safety with the recognition that we want to be, folks need to be at the beach. How do we help human behavior to stay safe? And I think we recognize that the best of our sort of automated plans, whether it be plots of area or sort of grids or whatnot, we're going to require a human touch. And we had a lot of discussion about beach hosts, about would they be respected, would they be egged, and the like. And there's also lots of conversation about the parking, as Nancy mentions. North Cove was a specifically difficult place because folks can drive there fairly close to the beach. So some novel ideas were put in, some signage and other ways to regulate the number of people at the beach. It was an interesting process. I'm glad that we were not Fort Lauderdale and we didn't have any super spreader events. I think we were also confused. I would see folks at the beach, huge groups of people, and only to learn that these were folks who were bubbling. And so we had to sort of understand how each individual groups were using the beaches as well. More than once I had to yell at some teenagers, you know, don't you see the signs around the climbing toys around this, that, which I felt horrible about. But they were respectful. It's really, I wasn't yelling at them. They were respectful. They got it. They're trying to have fun in the world that we've been living in as well. So it was this balance that I think came to a nice solution with the use of the beach hosts. Anyhow, Paul, what are your thoughts?
Well, I was going to talk about the phenomenon of bubbling, families bubbling together. We either had not anticipated that or had not seen it elsewhere. And some of the large crowds that Nancy saw were actually families that were, going through quarantine together. I think what set us off at one point was learning that there were barbecue, folks were cooking their food on the beach. And one of the things that we were saying don't do is, spend 2 hours, give somebody else some more time or some time to use the beach, be respectful of others. And one of the things we did not want to see were folks having barbecues on the beach. And yet it was part of family bubbles. So, we knew we had to make some adjustments and take into account these sort of new phenomena that were cropping up in people's efforts to have that social touch with each other, that social contact. That was a good learning point. And then, some of the beaches have little playgrounds, and that started in with some of the younger families saying, we were concerned about the touch point. And so we would have these sort of roped off, please don't use it. And but that was unfortunately leaving out a major opportunity for parents to bring their young kids to enjoy some time in the sun. So we had to do a reconsideration of that. I think we did a pilot test at South Cove Beach, and we saw that it could work. People would wipe, take care of their hands with sanitizer, etc., and that we would try to have a beach monitor or beach host to just keep an eye on those on the playground.
So we got a couple questions as we're going along here, and I would invite people, just the way this is evolving, it's probably a good way to do it. One comes from Rick Koresh, and I think this was talked about, Nancy, in some of your comments, but the observation is that the initial focus on surfaces greatly diminished, and the attention of the experts in science is now on breathing, coughing as the vector for the spread. Is that correct, and is it supported by the science? And maybe just commenting a little bit, as you started to, on how did that change our thinking in terms of some of the amenities like a playground and how we might manage that?
So, unfortunately, in about 5 years, we'll know all of the science, but it's still evolving. And I think, Richard, you're right in that the science does show that the major source of spread is through breathing, coughing, whether it's aerosolized and hangs out in the air for a long time or drops off. That's still a little bit questionable. Surfaces are certainly less risky, but you can imagine somebody coughing on a surface, and therefore there's still particles on the surface, so the surfaces aren't completely safe. And our philosophy has been, if you're particularly the playground where snotty-nosed kids, you want to clean it in between. You don't want a lot of kids on it. So even though we were able to pull back from the surface concerns, there's still a little bit there that we have to pay attention to.
And another question, Leslie, that came in from Duncan Wood, and it was probably one of the most difficult decisions that was made, is with respect to summer camp. There's an opportunity here to talk a little bit about the Family Advisory Council, so I'll invite Steve to talk about that. But the question Duncan has is around thinking for 2021 and maybe how we go about trying to assess what we can do and how we would go about doing it.
Yeah.
So Steve, maybe the place to start is the role the Family Advisory Council has played and how that came to be, and then evolve to Leslie here in terms of thinking for camp in 2021.
The one thing you don't want to do is take away activities for young families. And that's what we were doing when we said, you know what, no more playgrounds, and guess what, maybe the beaches are going to be closed, or you can't park close to the beach. And so the young families made their presence known very quickly to me, which was fine and appropriate. And from that, we've been meeting on a regular basis to talk about those issues that are specific to young families as they negotiate and manage this pandemic. We've talked about activities, and so when we decided to say, we can't do camp this year in person, how can we work together to come up with a bunch of virtual programs for our folks, or camp in a box where you can come up and pick up a container of things that you can do within your own pod. The family group has been wonderful to work with. They've helped us understand that there are these bubbles, that there are other ways to kind of approach how we manage our amenities. They've been essential in helping us with the family meal program that we're doing with Forbes has come through this group. Just ways that we can make life a little easier for folks that may be forced to work at home and also have their young family with them at the same time. If I can find a meal that I don't have to worry about, boom, that's a no-brainer. So it's been a great group to work with, and it's been kind of a good byproduct of this experience for us.
So Leslie, that group will be more or less interesting to work with depending on your answer to the question on 2021. So how do you think through that?
Yeah, so we are planning for summer camp. We actually have hired our summer camp director, Jody Bates, who is absolutely fabulous and has a teaching background and has been teaching during COVID, so understands programming with kids in masks and things like that. Right now, our thinking is if the kids remain in school for the whole year, that we'll be able to do summer camp, unless something significant happens with numbers, or if the state says for some reason that we can't run programs. We are modifying things. We're not planning, for instance, to take field trips this year. You know, getting 40 kids on a bus all together and going to, you know, another place, whether it's the Montshire Museum or things like that. So let's have those folks come to us, and then we can do things outside. So right now, that's where our heads are, is we're planning for it. We're hopeful, and we're making some modifications to camp.
So maybe just a very quick discussion about the restaurant, because that's something that's near and dear to everyone's heart. Leslie, did you want to talk to us a little bit about some of the things you've been doing there?
Sure, absolutely. So the restaurant started with takeout, and then we decided, well, can we do dining inside? Can we do dining outside? We started with outside dining with the tables spaced apart, following all the state guidelines. And then we worked towards, can we open dining inside? And I'm actually hoping to put Nancy on the spot a little bit with this, because she shared a fabulous spreadsheet from MIT with us that talked about airflow and how many people you could have in a room and whether they were masked or not, which led to some of the modifications we made to our air handling systems based on that spreadsheet. So
one of the advantages I have with my role now with the NIH is access to all sorts of different experts. And one group that we've worked very closely with are a group of mathematicians at MIT that originally had been charged with opening up MIT. And now they're actually providing guidance internationally. And so I just happened to ask, since we were working with them around how often people should be tested, I happened to ask, you know, anybody know anything about the spread inside and how you can safely open inside? And it was like, oh boy, do we have lots of information. And as Leslie was alluding to, the spreadsheet is quite profound, which goes to the detail of not only the floor space, but the ceiling height, normal airflow exchange, as well as what kind of activity are you doing. So the spreadsheet changes based on whether you're doing masked activities, whether you're just dining, whether you're singing, whether you're exercising. The rooms and the space and how safe it is changes in this spreadsheet based on all of those activities. And it really takes into account if one person in the room happens to have COVID, how likely is somebody else to get exposed to enough virus particles that they could contract COVID over what period of time. So if you're in the room for 10 minutes, it's different than when if you're in the room for an hour or so. So I can guarantee you that the average restaurant in the entire United States has not done the analysis that we have done with the MIT input, and definitely feel that we have one of the safest places to eat. So there you have it.
yeah, thanks, Nancy. I know that was really important when we were making decisions about which spaces to open up there, whether it made sense to use a tent, all sorts of things.
As well as we did this analysis, this is the ubiquitous we, this is actually Steve and his team did this analysis for every single room, public space that we have in Eastman to understand the safety.
So I thought that the other question that you get quite often is how we measure whether our plans are actually producing a safe environment. You can see on this slide a little bit of the guidance that we gave out to the community and how the committee was thinking about this, the panel was thinking about this, the staff was thinking about this. One of the questions that came in from Duncan was, gee, do we know if it's been working? Do we know if any of the cases reported for Grantham over the past year are residents of Eastman? So maybe, Steve, it would give an opportunity to talk a little bit about contact tracing, how that works, and what we know and what we don't know.
So I've certainly reached out to the town of Grantham, and as you know, Eastman is blessed with all kinds of experts, and we have another one that lives in Eastman that runs the Upper Valley Public Health Network, and reached out and said, how and when can we know if we've got cases here? And you know, for privacy reasons, it's not something that gets shared easily, and so certainly asked, and you know, please if we are aware of cases within Eastman, would love to know. We would certainly be in the loop, if you will, if there was a case that was attached to one of our amenities. So if it was at the restaurant or at South Cove or here at the center, we would know, because we would be part of the contact tracing. But if it's a resident and you know they're not at one of our amenities, it's in all likelihood we're not going to know until the general public knows.
I would open the floor for questions from folks on both this and other topics. Again, you can ask a question by typing in the Q&A or by raising your hand. There is a question about the restaurant, and this is one that the panel has spent a lot of time on. You know, we've got the Draper Room open. It's a great safe space. It has the ambiance that is probably a little better than South Cove, for those of you who remember when we were eating there during the renovation of the center, but certainly not as nice as what we would see in the tavern. So why don't we open a tavern? You could have limited bar seating, tables, kind of spread things out. Can you talk a little bit about the discussions that have taken place, and there have been a lot of them, as to how to think about managing the restaurant? Leslie,
Sure.
I'll have you start, and then the panel can chime in.
Sure. So, you know, lots of discussion about what spaces made sense, how many people we could have in the spaces, you know, and then also the piece of what we did to the air handling in the Draper Room in comparison to the tavern and hearth room. So certainly not the space that the tavern is. We did do some things in the Draper Room to hopefully make it a little more welcoming, but just discussion after discussion that we had about those spaces is what is the safest, in air quotes, place for people to eat if they're going to be eating inside. So if anybody else wants to chime in as to parts and pieces of that conversation that we had, that would be great.
I'll just say the math doesn't work. It's too few people, too little airflow. To make it safe for 5 people just didn't seem to make sense.
Well, I think that maybe, Ken, you can touch on risk. The whole concept of risk and reward, I guess, comes into play here as well. Yeah,
I mean, what we know for fact from science, as well as reading your local newspaper or television, is the super spreader events that have happened to date are indoors when folks don't wear masks. And I don't know of a mask that, other than maybe a straw through it, that successfully allows you to have a nice beer or eat a hamburger and not be wearing a mask. So I think in terms of risk, the highest risk setting is a congregation of folks, one of whom may have COVID, without masks indoors. And I have to say, Steve and Leslie have both done what is feasible and more. They've put in new filters into the air, into the AC, HV systems. People may not be aware of this. There's been a lot of modifications behind the scenes to make the drapery room at the restaurant as safe as possible. We have had more than one conversation about the tavern, and we're looking at the numbers that Nancy shows us. We're looking at the space, and the dilemma is it's just not safe for this, and we feel that the risk versus the benefit. You can get a drink in the drapery room. It's not like you can't have you know, a beer after golf or whatnot. But in that setting, if you look in the New Hampshire papers, restaurant after restaurant have had some super spreader events, some of whom have closed as a consequence. And there is that balance also. We don't want to have the restaurant publicize that on, you know, January 18th, 3 people came down with COVID. That's not good press either. So there's science here that's that we have felt to date. It's not safe to open that setting despite our best efforts. And there's also other implications if we did have a spread that we could have easily prevented.
So Paul, I might push this next question for you for starters. It appears that Sullivan County cases are climbing at this time. Do you see any impact on our amenities strategy going forward? And by the way, so pleased to hear about the camp possibility. This is from Dick. So what do we know about Sullivan County, and how does what we are seeing in the community impact our thinking about the amenities and what we can do here?
Well, it doesn't make us complacent. This is a very dynamic situation. Certainly some of the cases in Sullivan County were with institutions, nursing homes in Claremont, Unity, etc. But there has to be, we have to accept that there's community spread going on throughout Sullivan. So I think that we can't get complacent. We cannot just assume that what we're doing is going to be sufficient, but it doesn't mean that we should be changing them right now. We don't have any data to suggest that there's a need for change. We just have to make sure we continue to be as vigilant as we possibly can. And we know we're doing things well. Can we be doing things better? You know, it would be arrogant to say no, but we can't do it any better because we're capable of better. And if we have to, we will. So I think that would be my response to you, Bill, that we just have to always remain vigilant and always keep assessing what's going on, not only within Eastman, but we have to be cognizant of what's happening outside.
Other questions that people might have? This is a chance to ask them. You've got 3 really smart people and, well, actually 5 really smart people in your moderator.
Boy.
Careful, Steve. It could be 4 and the 2 of us. Well, I hope everyone has been able to get a sense of this great group of people that we're fortunate to have in our community and working with us. By the way, Sue Johnson offered a word of thanks, as did someone else earlier. It is one of the things that I've found that's really terrific as far as being here in Eastman. One of the pieces of insight they're looking for our panel to provide that I know, because we just talked about this on Tuesday, I'm not sure that we have any particular insight into, is when can we get a vaccine, and any thoughts in terms of how that might become more available here in Eastman. Ken, I'm gonna put you on the spot on this one. What are you hearing, and what are the things that might make Eastman a place that could be a distribution point somewhere down the road.
Yeah, this sounds familiar. We did talk about this the other day. DHHS, the website, you can get the current this week's data, projections and draft recommendations about how to provide the COVID vaccines to folks at high risk and frontline workers. As you know, New Hampshire and Vermont have been delivering these vaccines to healthcare workers, frontline healthcare workers, and as well via the pharmacies, CVS and Walgreens are starting to deliver them to the nursing home facilities. So they're starting, in nursing home, as Paul alluded to, many of the major outbreaks and deaths have occurred in long-term care or care facilities. 1B, which is high-risk individuals, folks who have diabetes or other medical risk factors, it's clear as mud because you read different things different times. The initial draft from the state of New Hampshire was that was going to be provided via folks' primary care docs. That is still on the board, although I've read that they're starting to wonder whether they can't send to local pharmacies a large contingent of vaccines for folks to get to as well. I think we're going to see a hybrid of both. You'll be getting a call from hopefully your primary care doc that their office is offering the vaccines. Hopefully soon, the pharmacies will have that available for the public as well. As to Eastman, Eastman Cares with Sue's work and Sally Wood's work and a number of other folks from Eastman Cares have been able to provide flu vaccines, but there's a pre-existing mechanism of reimbursement if you have Medicare flu vaccines routinely covered. COVID vaccines are covered too, but those mechanisms to provide in a small community like Eastman are not existent yet. So stay tuned. We're all sort of figuring out this from the state level. And I think I'm not optimistic that Eastman's going to be able to offer it to Eastman residents or to Grantham residents. I don't think that's likely. Public health facilities, the armory, the pharmacies, your doctor's office, I think that's going to be more likely the sites. And hopefully soon, hopefully in the next couple of months.
Thank you.
Oh, if I can just jump in for a minute, Bill, and say that in addition to what Ken has said, in February, February 12th, we'll have Dr. Liz Talbot here. She's the Deputy State Epidemiologist, and she is actually going to be talking about vaccines. So it is going to be a very, very timely, and I think this would be an opportunity to get information. So I encourage people. That's February 12th.
So Sue, while we have you here, we can certainly stay here longer for questions, but I want to thank you again for having the idea that it'd be interesting to hear from these folks and to give you a chance to talk about what happens next.
Thank you. I mean, I really want to thank you, Bill, for organizing the team, and to thank all of the panelists. I really do think this is truly an example of really what makes Eastman such a special place. And speaking from Eastman Cares, and I'm sure speaking for everyone in the community, we want to thank you for what you've done. We also at Eastman Cares welcome feedback. We don't have a formal evaluation mechanism anymore, but we do welcome feedback, and we do welcome evaluations. We do welcome future presentations, suggestions, so that if you have any of those, please send them to us at eastmancares@eastmanh.org. And we would welcome them. So from our perspective, thank you very much for attending.
And with that, I think we will bring this to a close. Cards and letters are always welcome. Leslie collects the agenda for each week's weekly meeting. So if there are questions you didn't get answered here or things you'd like this panel to be considering that we haven't talked about, please reach out to her, Leslie at eastmanh.org. We'll get her via email, and we most importantly, thank all of the people in our community, because it's one thing to put out all these guidelines and ideas and how we keep the community safe. It's another to actually have them executed. And one of the things, to Sue's point, that makes this a very great place to live is we've had such tremendous cooperation from the entire community. And that is a big, big part of the reason that we have been successfully working our way through these difficult times. So thank you all for joining us. And with that, we will go ahead and sign off.
Thank you.
Be well.
Thank you all.
Take care.